Good morning. Good morning, everyone. Hi, Marissa. I've got got my little guys home with me today, so it's going to be a little chaotic on my end, but
Problem. I'll pause the recording until the presentation starts.
my phone.
Ellen, Cynthia, try to remind me if not. Thank you. Good morning, guys.
Say good
Good
morning.
morning.
Hi,
Morning.
Cynthia. This is Danielle.
I'll stop the
That's
recording. Oh, hi, good morning. Home from school today.
no school. That's right, no school. Oh my gosh.
All right, that's great.
He checks every morning. He's like, no school? No school. It's no school. It's no school. That's right. Yeah, I need this one. You need that one. I thought it'd be less distracting on my phone, but I don't know if that's I
No,
might
it's
switch.
fine. it's just new. That's why. In a couple of minutes, they'll be doing their own thing.
Oh, look at that. Oh, sorry.
Love the flyer, April.
Thank you. Thank you very much. I actually noticed I put the wrong one. I didn't put the one with our email address, so I'm looking for the correct one. I'm sorry. When you make them 100 times before you get it all correct. I know you guys know.
Hey, good morning, everyone. It is 9:30. We'll get started in a few minutes, but just wanted to welcome everyone. Thank you for attending. I anticipate we'll have a large influx of people registering and logging in within the next couple minutes. So we'll probably get started at 9:35. We have a great agenda for today. We're very blessed to have Winnie Schiff, the Executive Director for the Interagency Council, to report on the budget and what's going on, give us an update. There's probably nobody more in the know than Winnie, just with what she does in her current capacity, working with our legislators and OPWDD closely and advocating for service providers and family members. It really is such a critical role that IAC plays for organizations, for families, for OPWDD. So we're very fortunate to have her knowledge and insight for today's presentation. But we'll just give it a couple more minutes and then we will get started. Thank you. Okay, we'll get started because we will have a quick SIDDC jingle. So, Michelle, if you don't mind starting us off with the jingle.
Got it.
If you need a helping hand to lift you up and take a stand, there's a place where you can go, where we're here to help you grow. Join the SIDDC, your local hub for advocacy, creating equal opportunity at the SIDDC.
Okay, thank you, Michelle. I know Irene and I are going to be singing that all day long now because that is so catchy and it gets stuck in it. Irene can't help but dance every time it plays. I always watch you, Irene, because I don't
It's
know if anyone loves the jingle more
amazing.
than
It's
you.
amazing. Every time I hear it, I think, they did such a great job and we're so lucky to have it. It's great.
It really has. It's I think during the pandemic, right, was probably when that was instated and it's very catchy and it's been a staple for us now for years.
Yeah.
That's great. Well, welcome to General Council meeting. Thank you everybody for joining us. We have over 50 attendees. We anticipate a few more as the day goes on, as the meeting goes on, I should say. So today we have a great agenda ahead for everyone. We have Winnie Schiff, the CEO for the Interagency Council, presenting on the budget. For those of you that just logged in, again, just a little background on Winnie. Winnie is a tremendous asset to this industry as a whole. Her knowledge and insight in supporting agency providers, families, advocating, working very closely with legislators, OPWDD, just kind of brings it all together. It's a great resource for everybody. The Interagency Council, if you're not a member, I certainly encourage you to look at what they do. Just I know a lot of agency providers work closely with them. They conduct trainings, they give information. During the pandemic, they were just such a big resource for all of us and such a support. We just appreciate everything we do. And there's really nobody that I feel can speak more informed on the budget and will give you a very straightforward perspective than Winnie. So, Winnie, thank you so much for being here today, taking the time to just give SIDDC all of this information. I know you're super busy. But without further ado, the floor is yours. Thank you. Welcome, Winnie.
Jason, thank you so very much. And I must say that there is no group as focused on advocacy as Staten Island DD Council. I mean, you guys show up all the time, and thank you so much for all of what you do. I also just want to say that I had a flu shot yesterday, and I really am suffering the effects of it in a surprising way today. So please excuse me. But anyway, so this year, the governor put out her proposal on, I think it was January 19th. And what all of us advocates do is take a look at what's in there, what's not in there, and formulate our requests for the final budget. So the rest of the process goes like, the governor first of all, we target the governor's office and make sure that they know what it is that we want, hoping that she'll put it in her proposal. Then we, reformulate our asks, and our next target is the legislature. So the Assembly and the Senate each put out their one-house budgets, and then the negotiation happens. Of course, it's happening the entire time. But so right now, our focus is on the legislature and trying to get what we didn't get into the governor's budget into the Assembly budget and the Senate budget. So what we're going to do today is go over what is in the governor's proposal and then what is not in the governor's proposal and our asks. And we're going to cover the areas of OPWDD, which is a lot of where our services lie. Also the State Education Department for education, and then the Department of Health for early intervention, and also our clinic programs. So, as we were all very, very worried, we thought maybe that there would be a big budget deficit to cover and that there might even be cuts to Medicaid, generally speaking, that would cause suffering across Medicaid populations, and we are certainly one of those. But it didn't work out that way. We did well this year. The governor was able to eliminate the $4.2 billion budget gap in this year's budget because we had higher expected income tax revenues. And even with that $10.3 billion federal funding cut, including $3 billion directed right at Medicaid, we were able to avoid any cuts. In fact, the budget is a little bit bigger this year than it was last year. The other thing that happened is that we got an extension on the MCO tax issue. The MCO tax was going to be eliminated. We got a 9-month extension, and that added another $1 billion to the budget. So we don't know where that $1 billion is going to be spent. There's lots and lots of people who are saying me. So we're one of those groups, of course. The overall budget is $260 billion. That is a 0.7% increase over last year. And the governor has included language to direct Department of Health to submit an application to CMS to return the essential plan to a basic health program. And this would preserve cost-free coverage for 1.3 million New Yorkers who would otherwise lose it. We were worried about both our DSPs and our families in that group. That move, though, will cause 450,000 New Yorkers to lose their current essential plan coverage. Of course, without those tax credits, that has become much less affordable for those groups that we're worried about. There are negotiations underway with the federal government to develop other affordable coverage options, and there's other groups, not ours per se, but of course we support their efforts, who are working really hard at trying to get the state to cover some of those expenses as well. She's also protecting New Yorkers by advancing legislation to ensure that New York can set its own immunization standards, and that will guide school, clinical practice, and insurance coverage here in New York. And, generally speaking, it is an election year, and they are very focused on making sure that nobody gets hurt this year. And before I continue, I want to say that I think I'm joined by two of my colleagues. So Kate Hoy, I think, is with us. I think she might have just put something in the chat. And I'm going to cover the entire budget, but I will defer to Kate when we get to the sections where she is the expert. And I also want to take a moment to introduce you to Joe Medler. He actually just started yesterday, but he joined us today. He's our new Vice President for Adult Services, and you guys will be seeing him quite a lot. So welcome, Joe, and Kate, I'm glad you're here. All right, so the governor's budget specific to OPWDD has a 4.6% increase in spending, which equates to $342.8 million. And she included a 1.7% targeted inflationary increase. That used to be called the COLA, but a COLA is sort of equated to salary increases, which of course it's salary increases, but that's not all it is, because our COLA covers all of our expenses and we need it to be applied across the board. So calling it a targeted inflationary increase is actually a big help to us. We were sorry to see that CCOs were not included, because they really do need to be included in that figure. And also the CPI for July was 2.7%. So the governor put in 1.7 as a good starting place, but it is not actually the number we need, because if it costs now 2.7% more to provide services to people, because that's how much the CPI was, then that means that if we don't get 2.7, it is essentially a cut. So we'll get to what we're asking for in a minute, but it is the 2.7% on the TII. All of the services that have traditionally been included in the COLA or the TII last year are included again this year. There's also a 5% increase in family care rates. And then there's a whole bunch of ads that happen every single year for the past 7 years. So one of them is an additional $15 million for OPWDD independent supportive housing initiatives, which we would like to see grow. It's really not enough. It goes away right away, but at least it was added in again this year. Then there's another $30 million to fund new OPWDD services. So you might hear this talked about as $120 million, because that is all shares fully annualized. So $30 million is the state share for 6 months, and that has to cover new and changing service needs, expansion of home enabling supports, which was just contracts awarded to agencies, to from transportation increases for Dayhab, and also property cost increases. So it's not all just new services, it's also increased expenses in those other areas. Then there's another $39.3 million to support minimum wage increases. As you know from last year, minimum wage has been it's been set in stone that every single year there's going to be an increase for minimum wage. And so we need to keep up, because we need to keep away from that number. Our jobs are not minimum wage jobs, and we need to make sure that we stay away from minimum wage. There was no cut to family support services, despite what you might have heard. There is a decrease in the appropriation, but that is because there are reappropriations from previous years for money that was unspent. Now, it was unspent because they made it so impossible to spend that money that we still have it from previous years. So it's not like we're fine. That's still an area of concern, but there wasn't an actual cut. The governor put in a bunch of other little things that are nice. There's a new inclusive SUNY and CUNY program directing a partnership with SED to establish a formal transition process from high school to college for students with IEPs. There is an Assistive Technology Innovation Center, and that's going to be run by the Empire State Development Corporation to foster collaboration between researchers and private partners to accelerate the innovation to market pipeline for new assistive technology. She proposes to expand the Fashion Innovation Center with a grant program for designers, entrepreneurs, and researchers to promote the development of adaptive clothing for people with disabilities. And there is a DOH's Disability and Health Program, which is going to be put on in collaboration with the Office of the Chief Disability Officer, where they will collect and analyze data about healthcare experiences to identify barriers to care and inform an action plan. So that's not, something that will benefit us directly this year, but certainly good for future. Now for our asks. So like I said, 1.7% for the TII is not enough because we need 2.7. And really that was a minimum conservative number because over the years where we were receiving no increases and our expenses were going up, we're still recovering from that. So we really could use more than 2.7, but preparing for a year that was going to be difficult with the federal cuts, we decided we wanted to be conservative. So we're asking a 1% increase. As usual, we are being joined by the other O agency constituents. So it's OMH and OASAS. And everybody will be included in that 2.7% TII, and we're all pulling for the same thing. So that will cost state share $106 million. And then we have a few proposals that we're calling CareForce proposals. I love the name CareForce because that is, not just DSPs, but other direct care frontline workers who support people in our programs. So the CareForce that we're talking about are DSPs, certified nursing assistants, LPNs, RNs, behavioral health and human services staff, excuse me, and early intervention and special education therapists. So these are all very underpaid in our world, and we want to make sure that these CareForce proposals apply to each of those professional groups. So the first is an affordable housing lottery preference. So we're looking to create an affordable housing lottery preference within state-supported housing programs. So there are programs that already exist that would prioritize these workers for affordable units near their workplaces, supporting workforce stability and community continuity. And there's a bill, and we have it in our white paper, so I will share that so everybody knows the bill to refer to. And I'm not sure if it was introduced in the Assembly yet, but it was introduced in the Senate by Pat Fahey. And in fact, there is a bill for each of these initiatives that Pat Fahey in the Senate, who is our chair, Senator Pat Fahey, has introduced. The next one is to establish an employer-assisted housing matching grant program. So our agencies lack the tax advantages available for-profit employers that offer housing benefits, but we're looking for a state employer-assisted housing matching grant, providing a 50% match up to $3,000 per worker annually, and that would be used to support employees with security deposits, rent support, emergency arrears, or first-time home buyer costs. And again, there's a bill in the Senate for that. And I will update when I share our white paper with the bill numbers, whether or not there's Assembly bill numbers already out there. And I'm sorry, I don't know that yet today. The next proposal is also for home ownership, and it's to create a Sunny May CareForce homeownership incentive. So we're looking for a program to offer enhanced down payment assistance up to $20,000 and reduced mortgage interest rates between 0.5 and 1% below market for frontline care workers. And this would expand access to homeownership for DSPs and also all of those other workers in the CareForce that I mentioned before. And again, we have a bill number for that. Then the last thing, or two more things actually. One that the governor actually included in her proposal, which is in the revenue bill Part A, and it's to enhance the New York State Child Independent Care Credit. So we are supporting the governor's proposal to enhance that New York State Child Independent Care Credit. And then also, back in the day, we used to have this thing called a healthcare enhancement program. And this was, federal share and state share together to provide increases to our agencies just for healthcare for our workers. Because we don't pay that great, but we have had really, really good benefits. And that is one of the reasons why people come to our field, aside from the fact that we do amazing work that everybody loves to do, but we also want to take care of our workers. So that went away a number of years ago, and we're asking now for that to be restored. And that will cost the state about 85 to $100 million and would provide $2,500 per eligible employee to our agencies for us to either reduce employee participation in health benefits or expand the offerings that we can give people. So does anybody have any questions on the OPWDD stuff that the governor put in her budget and things that we're asking for?
Hey, Winnie.
Hi.
Sorry, you're not feeling well. Hope it passes.
Oh, thank you. It will. It's just
yeah,
this
Takes
dumb
its time.
vaccine.
Yeah. When is the TII effective? The 1.7%?
Yeah, so that'll be 4/1/26.
The usual April. Okay,
Yes,
good.
exactly. Or
Thank you.
whenever the budget is passed, it'll be retroactive to 4/1. But we're hoping it's 2.7, not 1.7.
Yeah,
Ellie.
hopefully. Thank you.
Ellie.
Yeah, what's the total cost that we're asking for to add to the TII? And then what's by including the CCOs, which only is for OPW, not the other O's. How much are we adding there?
That's true. I don't have the number for adding the CCOs. You know what? I'm going to send a quick text and see, because I said it was $106 million state share. That includes all of the O agencies, and it might actually include CCOs too. So let me just, you know who I'm asking.
I
It's
do.
Evan, who is NIDA's lobbyist.
Yeah, I could just imagine the pushback. So let's
Yeah.
get ahead of the pushback.
Yes. This is something that is largely supported by the legislature and even the governor's office, although
But she didn't include it, so you know.
exactly. She put in her 1.7 and she didn't include the CCOs in 106. Okay, let's see if Evan gets back to me. He's usually very prompt. Donna.
Two things. Winnie. First, thank you for coming today. I know you have a lot going on, and now with not feeling well, it does adds to it. But we appreciate it. We
I'm glad
appreciate
to be
you.
here.
Thank you.
I appreciate you.
I don't know if there's a rumor, but there was word on the street that there's large monies in the rainy day fund. Have you heard that as well?
Yes, definitely.
Okay, so we have to keep that in mind. And secondly, with the 1.7 ask for 2.7, it's time for us to now start getting to our local assembly, Senate, to get them to understand the need for this percentage increase and all, because March 19th will be here before we know it, and we need to prepare for that. So I just wanted to mention that as well.
Absolutely. So first of all, with the rainy day fund, and you know, the state has money. We're asking for almost nothing compared to what we need. So we have absolutely every right to ask for this. So Donna, yeah, thanks for that for sure. And we're asking for 1 additional percentage point. It's really, really a modest ask. Okay, let's see if Evan got back to me. He did not. Okay, but I will let you know when he does. Okay, so under the category of early intervention, despite all of our work in previous years and the recognition by the Department of Health, the commissioner of the Department of Health is a pediatrician who has a child with autism. And really supports early intervention. We were unable to get the 10% that we asked for last year, and even the 5% that they finally did give us has not been put through because there were technical issues with getting the It's called a state plan amendment into CMS to be approved, so we're still waiting. But this year, again, no early intervention rate increase, despite the fact that there's such promise in that program, and we haven't really received a rate increase in 30 years or more. What she did add was $100,000 to alleviate barriers to hearing loss screenings and language acquisition services for children who are potentially deaf, deafblind, and hard of hearing. She actually created some savings by creating this program called Centers of Excellence for ABA. It's a designation for providers that will ensure that evaluations and referrals for ABA treatments are clear and appropriate. And the savings associated there is $13.7 million. This is just general DOH too. Those are the EI. Well, ABA is actually something else outside of that too. But there's a limit on personal care administrative reimbursement to 15% of total costs. And the governor expanded the scope of practice to allow physician assistants to practice independently, medical assistants to administer vaccines, and changes to state law to allow DOH to oversee licensed healthcare professional scope of practice, I guess, rather than the state education department's office of the professions. She added $75 million to maintain the medical indemnity fund through 2027. And the governor has a proposal to leverage federal funds to provide $694 million to implement 2 workforce programs for the education and training of the health, behavioral health, and social care workforce for nurses and clinicians. And that's really just for nurses and clinicians, not for other healthcare professionals. So from the federal government, New York State was awarded $212 million for the first year of a 5-year rural health transformation program, and none of us are in the rural area, so it doesn't really affect us, but it's to be used for rural communities to strengthen integration, technology, data tracking, and cybersecurity. So for our asks, under early intervention, we want the state to immediately implement the state share of the 5% early intervention increase retroactive to October 1st, 2024, which is when we should have gotten the entire thing. But like we said earlier, CMS is still hasn't approved the state plan amendment to give us that 5%, but the state included the state share in the budget 2 years ago. So that should be paid right away and retroactive to the date that we did set aside that money. We are looking for an increase in reimbursement rates for EI to begin to approach actual service costs. It wouldn't even bring us very much closer than where we are now, but we're asking for 8%, which would be better than what we have now, obviously. And we're looking to include the early intervention reform bill, which has been introduced over the last couple of years and again this year in the final budget to conduct a comprehensive assessment of the EI program and system to accurately assess actual costs and determine appropriate reimbursement rates. Does anybody have any questions about EI? And now I'll also open it up to Kate. Would you like to add anything on the EI front? Okay. Under clinics, our Article 28 clinics are like regular medical clinics not operated by OPWDD. Those are Article 16 clinics, and we have our share of other problems there. But for the Article 28s, we want to implement, again, the governor's budget in 2024 gave us a 30% increase to Article 28 clinics, and we haven't seen it yet, and it's the same situation where the state plan amendment was sent late to CMS, and we're still waiting for it to be approved. So we want that state share of that money retroactive to 10/1/24. And what we also want to do in order to protect our Article 16 clinic patients, because of recent changes for the Article 16 clinics and who is eligible to receive services there, we want to exempt long-term therapy services for individuals with a diagnosis of IDD or TBI, traumatic brain injury, and who don't qualify for OPWDD services, to make them exempt from the managed care, so that the long-term services can be directly billed for fee-for-service in the Article 28 clinics, since they will no longer be able to receive, and I'm talking about the patient's services from Article 16 clinics, unless you're OPWDD eligible. It no longer qualifies you just because you have a diagnosis of IDD or TBI. And then we want to authorize joint licensure for Article 28 and Article 16 clinics that serve individuals with developmental disabilities, so that we can eliminate redundancies and provide better health care. And we found out just the other day that the Department of Health is actually working on something like this. So that's really good news. And we'll update you as we learn more. On the state education side, our schools are really not included in the budget per se. We get increases as proposed by SED to DOB, the State Education Department, to the Department of Budget. And that happens after budget, statutorily required by April 15th. Of course, the conversations are going on before that and right now. But the governor added in her budget $1.6 billion, which is a 4.3% increase for school district funding, and that includes $561 million additional for UPK. She expands eligibility in the Master's in Education Teacher Incentive Scholarship to include those people in master's programs in early childhood education, and for enrollees to satisfy their service obligations by working at eligible childcare agencies. I am not sure whether we are eligible childcare agencies, but we're looking into that. And she extended OCFS childcare program licenses or registrations from 4 to 6 years, and gave OCFS greater flexibility on setting training standards for staff and volunteers. There's also $45.6 million in capital improvements at 5 state-owned schools, and that's worth mentioning because our schools are still fighting for money for capital improvements. Excuse me. So we know that there is actual work going on right now, and since last year, between SED and the Division of Budget, to include capital costs for 4410s in the existing regulations. And also, we're hoping that they have in those conversations an allowance for 853 capital expenses that are under $100,000, because right now, if the expense is under 100,000, that school does not qualify for the capital expense funding. We don't want to interfere with discussions that are happening right now, so we are supporting those conversations, and we'll continue to stay close to SED, and hopefully we'll end up with a good change there. But there are a couple things that we do need to have in the budget. So one of them is FAPE 22. So that's free and appropriate public education. As we all remember, it used to be that our students until the age of 21, actually until the end of the year during which the student turns 21, that they could stay in their special education classes. That was changed to 22 because over the pandemic, there was a lot of difficult to participate virtually, and students were really falling behind. So that was continued even after the pandemic, but there's no funding for it. So what we want to do is make sure that there's funding that to support students through June 30th of the year that they turn 22. We're also looking for, there's a fund called Excessive Teacher Turnover Prevention, and that is targeted at schools that have high turnover for teachers. And we're looking for an additional $5 million for that fund, which is also a very, very modest increase. But we also want another $5 million to expand that program to include other direct care instructional titles like one-to-one aides and teacher assistants, because right now it's only for teachers. And we have a shortage in every professional group there. And then we have a request for children's residential programs for funding for clinical teams to strengthen our ability to work with students who might otherwise be sent out of state due to their high support needs. So those are our asks for the budget. When it comes time for April 15th, we're going to be asking for a lot of other things for our school, including a tuition increase and some modifications to the tuition methodology until the new methodology is rolled out, which is not going to be for a number of years, but they are working on it. Does anybody have any questions on any of that?
Yes. Hi. My name is Peter Coleman. I'm part of the enrollment department at Care Design. Thank you for being here. Thanks for this presentation. There's a lot of smoke about what you mentioned about the Article 16 clinics, right? As someone who has worked alongside of my coworkers, and I've been getting people through the OPW system for 20 some odd years now, the Article 16 clinics are our life's blood. That's not an exaggeration. Can you please elaborate on that and what the rationale is behind that? Is this just a budgetary thing? And exactly what are we looking at right now?
So I'm not going to be able to say anything that makes sense, but here's what I know. We're really only talking about 600 or 700 people who will lose access to services in Article 16 clinics because they are not OPWDD eligible. So it's not a giant savings. And what OPWDD is saying is that they never should have been serving people who are not OPWDD eligible. And, you know, in a certain way that makes sense because Article 16s are run they're administered by OPWDD. So there is a logic to that. On the other hand, for the 600 or 700 people who we're both talking about, all of a sudden they don't have a place to receive services from people who really know how to work with people with IDD. Right now they do, and they're not going to be able to access those services anymore. So our real focus right now on those people are, let's create a smooth path for them to be served by a different type of clinic, because boy, we fought against this move for a very long time and we lost. So again, it's not a huge savings. So what we really need to do is make sure we're taking care of that group of people. And that's
where is the 600 or so? I'm sorry, where is this? Fortunately for people we service on Long Island, the schools are there to do evaluations. We're grateful for that.
I'm glad you mentioned that.
Yeah, but in the city, the Article 16s, I'm wondering where the 600 or 700 came from, because in the city, it is our absolute life's blood. Places like NYSID, YAI, AHRC, QCP, HAMASPIC, we can go on and on.
Yeah.
Where is that number coming from? Because I can't believe it's that few.
So I'm glad that you said evaluations, because I should have been clearer about that. Article 16s can still do evaluations to determine eligibility. So that will continue.
Okay.
But if the person is determined not to be eligible, then they can no longer receive any long-term therapies from the Article 16 clinic. So that's where they get cut off.
So the evaluations will not be affected by this?
No.
Okay. Okay. Thank you so much. Sorry.
Right. And that's why it's so few people, because those are the ones who are found not to be eligible, but they were receiving long-term therapies through the clinics.
Okay. I think that there's some misinformation about this, so I'm really glad that you cleared that up. Thank you.
And I'm really glad you asked that question, because I was not clear about it either. So thank you.
Okay, thank you.
Sure thing. All right. So we continue. There's going to be a rally at the Capitol in the War Room, which is our favorite place to do it. It's a little bit inconvenient because it's a little bit of a small room and it gets quite warm, but also if 300 people fill up that room, we really look big. And Staten Island always shows up to those rallies. So it's March 10th. I think it's 11:30. Again, we'll provide information if you don't have it already. that's when the next rally is. But there's other rallies going on in other parts of the state, and we'll keep at it, and we'll keep giving you information on our success or lack thereof, and hopefully we're going to get that 2.7% TII.
Hi, Winnie. Nick LaBruna here. I have a question. So go back to those 600 or so people that might lose the long-term therapies. What kind of therapies are we talking about? And is that across all of New York State or just the New York City or downstate region? And are they adults or children?
Both adults and children, all across the state, OT, PT, and speech.
Got it. Thank you.
Sure. Any other questions? All right. Well, thanks for doing all you do, and I'm so glad to be with you this morning. I miss you guys. You're the best, and I'll see you again soon, I hope.
Thank you, Winnie.
Thank you. Really appreciate your time. That was very insightful. A lot of information you gave within this last hour. So thank you. I hope you feel better as well. And thank you for pushing through that.
Thank you. Thank you.
Okay, so moving right along, I see we have Contessa Officer here from OPWDD. Contessa, would you mind giving the OPWDD report?
Yes, good morning. Okay, so today I just want to talk a little bit about home enabling supports. Can you guys hear me? Okay, great. So home enabling supports are a new service for people who are enrolled in the waiver program. It's a subcomponent of our assistant technology. So with this particular program, it's going to be rolled out in March, sometime in March. And so in 2025, we chose providers throughout New York State, and the two providers that were chosen for regions for New York City and Long Island, Region 5, were Center for Family Support and Person-Centered Services. So these are the two providers in our area. So with home enabling supports, the purpose really is to allow these technology devices or programs to help people be more independent, improve interactions with others, and basically to be able to really be person-centered. So I want to share with you guys a little bit about each area of the home enabling support. So there are three areas. The first is assisted devices or technology. Then you have remote supports, and then there's the health assessment and coordination services. So these selected providers will be able to purchase these home enabling supports on behalf of persons with a reasonable expectation that has been identified across services, so that they can, its focuses on safety, independence, and just more meaningful health outcomes. So let me share with you a little bit about what each area focuses on. So for instance, assistant devices. So these are devices that are designed or made or adapted to assist people to perform a particular task. So for instance, voice activated lights, thermostat, or window shades for people with mobility or dexterity limitations, home security systems, such as one-way video doorbells, sensors for safety and or to control other devices like lights, smart locks for people with dexterity or mobility limitations, remote garage door openers, safer cooking appliances. All right, so those are just some of the assistant devices. And then there's an area called Health Assessment Coordination Services. And this particular area focuses on 24/7 consulted telemedicine services. For instance, being able to get advice on when to best seek additional or in-person treatments, coordinated care with local emergency departments, urgent care centers, and primary care physicians. So it can enable real-time support, consultation, and coordination health issues. Also, assistance to people or families, and to support providers to understand presenting health symptoms and to identify the most appropriate next steps. So that's a very exciting area. And then last is remote supports. So remote support is the provision of supports by a vendor, which includes two-way real-time communication using audio or video technology to allow the person to interact remotely with others for assistance. For example, subscription-based services, scheduled check-ins, on-demand support, like the person contacts a remote support professional as needed, and some other items, for instance, sensor systems that trigger an interaction, such as seizure mats, door and floor sensors, motion detectors, heat and smoke detectors. So this is, again, very exciting to have these additional supports available. So you will hear more about it from the providers as well as care coordination. So just want to put that on your radar. If any of those items could improve quality of life for the people we serve, this is a great opportunity to look at some of these different features that will be available in 2026. So yeah, that is it for me today.
Thank you. Does anyone have any questions?
Yeah, I have a few
Yeah.
questions. Who can obtain these home enabling support devices? Do they have to be people that live in independent type support systems, or can people in IRAs obtain them?
Great question. Let me just go back to that. So let me just go back so I can give you that. Okay. So who can receive them? They have to have waiver and live in a non-certified residence.
Okay. And the other question is who is providing these real-time supports? Is there going to, and where are they? Is it going to be like a group of people? Just, can you explain that a little bit more?
Yeah. So without getting too much into detail, because these are going to be services that are provided. Some of these services people already have, say for instance, people who may need a device to, if they need help, instead of going to urgent care, you can have like a nurse on call, like a service, right? So these are services that are already out there where people obviously would pay to be able to, get someone that's monitoring how they're doing, someone they can call to get information, to, instead of going to, to the hospital, they can let the person know, oh yes, you should go to the hospital, or, maybe you can do this or whatever. So it would basically be services that, fall under safety. And again, it would kind of be up to the providers to, decide like which services, would be relevant to that individual. So it's going to be very person-centered. So I don't have like the name of the providers, but as long as they fit under the service, they could be eligible.
Will they be hired by OPWDD, do you know, or they'll be like a contracted out?
Oh, this will be, yeah. So this is going to be funding. So the providers, if a person qualifies, the provider would have that money to, offer that, that service, so yeah.
When you talk about devices, does that include hearing aids or eyeglasses?
It does not. It's really supposed to be assistive technology, but it's very specific to I want to look at the, yeah. So these are things that are a little bit more useful for an individual to help them be more independent, or to be able to purchase certain things that, are just easier for them to use. If somebody likes to cook, maybe a crock pot or an induction stove or something like that, that's maybe safer for them to utilize. But in terms of like glasses and all of that, that's more medical. So that doesn't fall under, that wouldn't fall under.
And it would
And
not.
hearing aids wouldn't necessarily fall under this program because it's more medical. These are mostly devices. It could even be something like to help you write better, gripping, possibly a device, but not medical items. I say, yeah, there's no, it's not really a medical program. It's more assistant, devices to help you throughout your day. I hope that answers your question.
Thank you. Marianne, I see your hand is up.
What about assistive technology like AAC and things like eye gaze to enable that?
That's possible. Yeah, that's a possibility. Again, a lot of this is going to be, vetted, and you will get more information as to the types of devices that fall under that.
Okay.
Yeah, these are just some general areas where, you can, have an idea of the type of devices that they're looking to pay for. So the list is not, exclusive. But I would say if it's something that you think would help the individual or the family, you would speak to the provider to find out, because you just never know what would fall under this.
Okay.
Donna?
Jackie and Donna. Donna, go ahead.
Okay, I just have a quick question. Was one of the agencies awarded this person-centered care services on Staten Island? Or was there person-centered services in Long Island?
It's in person-centered services. So it's Region 4, so it would be Staten Island.
Okay.
Jackie?
Hi, so 2 questions. Does this apply for individuals who receive housing subsidies within the 5 boroughs, within the Region 4? And then for individuals who do live at home, is there an age limit? Like, so if I have a 6-year-old who needs to do something, and families are looking for this technology, are they going to be able to access this service?
There's no age requirement. And in terms of the subsidies, I believe so. Don't hold me to that, but I believe that yes.
Contessa, I think when you had the criteria, it mentioned non-certified, which would be subsidy, so it sounds like it.
Yeah. Contessa, is there any way to just so I can research it, put a link or the full name of the program?
Yeah, I don't have an actual link right now, but you guys will bring more information back regarding this. And as providers and the CCOs are more educated, on how to go about, applying for this and all of that. But I just wanted to put it on your radar because, there's a lot of different options I can see potentially with this program.
And it's called
Home and Neighborhood Supports.
Thank you very much. It was great.
Any other questions for Contessa? Okay, well, thank you very much for sharing that information and
Sharing that information and the
report.
WGD report. Could add Jason that this will, I guess it's a weird. It as a direct provider support. If you have a budget for self-direction, this will be added with units for someone who's in the chat. We don't know what that is yet, but there's going to be units. There usually isn't a limit when you do direct provider.
Thank you, Fidaya. Okay, so moving along, Melissa, would you mind giving us the treasury report?
Yes, so we currently have $4,133.42. And Contessa, I'm very excited to hear about the home enabling supports because we have so many individuals that are trying to live independently and they really need that assistive technology to be fully independent. So thank you for that information.
Thank you, Melissa. Also, we did have a DOH-MH representative on the call. I don't know if she's still here with us, but she said there are no updates to report at this time. So without further ado, we will move to committee reports. We will start with Adult Services. I believe Diane is on, and I'm not sure about Kathy. Diane?
Yep.
Kathy?
Kathy's on. Good morning.
Hi, Kathy. Sorry, I didn't see you. Hi, Diane.
Yes, good morning. So we are going to meet on March 23rd. The meeting is open to everyone because we're going to have a presentation. Our presentation will be on autism on TikTok, thoughts, concerns, and accuracy. So this talk will be for any person who would like to expand their knowledge regarding social media and how it affects our individuals affected with cognitive, social, and communication challenges. So I don't even have a TikTok account, but most of the world does, including individuals that we serve. So it will be a very interesting talk. We thought it was different. It's going to be, the speaker will be my son, Michael Perugia, who's a medical doctor at Mount Sinai. And this is part of his research. So I'm interested in it, and I hope you all spread the word and join us. It will be in the evening on March 23rd at 7 p.m. In the chat is the link and the flyer. And we also, if you go to siddc.org to our calendar, the link will be there as well. Thank you.
Thank you very much, Diane. On a separate note, I just want to congratulate you. I don't mean to embarrass you, but Diane will be getting a nice recognition at the Minty Gala next Thursday. Very well deserved for all of your efforts and advocacy, everything you've done for this field. You are truly a pioneer, a wonderful mom, first and foremost, but professional, and just wanted to congratulate you, and we look forward to celebrating your honor. Okay, moving along, we have advocacy. They have been super, super busy. This is their time to shine, their month. They've been working really diligently on setting up an event, a nice town hall that we have next week, which I'm sure they're going to speak on. So Donna and Barbara, advocacy report, please.
Oh, thank you, Jason, for that. I guess we'll start with the town hall, which is a week from today. And by now you should have received numerous flyers for the event. It's at CSI. We have 4 panels. We have a panel discussing recertification and Medicaid, a panel discussing supports and services, one for advocacy, and one for a research group that consists of self-advocates. So we're really looking forward to it. We've been meeting weekly for quite some time now to ensure that this is well put together and that the topics are something that is of interest and pertains to everyone. To date, we have about 150 people registered, but you do not have to be registered to come, and that states it on the flyer. So please come and join us. Please disseminate the information. I understand it's out there on Facebook and other social media platforms that I am not on, but it's out there. And so that's a good thing. And we really welcome you to attend as well as bring other people. We've invited our legislators, but we invited them to listen and be informed, and not to speak, because we really want them to understand what's going on and the concerns that we all have. That's, oh, okay. I put that listed on the calendar as well, the SIDDC calendar. And then just real quick, and then Barbara will probably give the breakfast report. Winnie mentioned the rally on March 10th in Albany. There's also the rally in the Valley on March 13th. There's also, and I don't have tremendous details on this, but it's a not town hall meeting that New York City Fair is hosting, and it's on March 11th from 7 o'clock to 8:30. Details will follow with that, with a flyer that can be disseminated as well. The One House, as was mentioned before, is March 19th, so we do need to get to our legislators and really impress upon them how important it is that they vote for the asks that we need. And there will be a NIDA one-click that's coming out. I thought it would have been out this week, but as soon as it gets out, we'll disseminate it to Marissa so she could disseminate it to the membership. So those are the dates that we have right now. So please join us at the town hall. And Barbara, is Barbara on?
Yes, I'm here.
Okay, sorry.
I'm here. Okay, thank you, Donna. Following that, on March 6th, the following Friday, we're participating in the citywide annual, they call it the legislative breakfast. This year they changed the format, and so instead of boroughs reporting on certain topics, the topics of which are similar to what we're doing at our town hall, they're going to have different panels, but their panels are going to consist basically of legislators. But also that information should also be on the SIDDC calendar, and we should be sending that out. That you do need to register for to get the link to get into the meeting. But again, it's on Friday, March 6th from 10 to 12. And we'll hear what the legislators have to say on all these topics. To just throw in a thing, ours will be much more informative, I think. You think?
Thank you. And I agree. I mean, thank you. Barbara and Donna made a very conscious effort this year as we were kind of talking about the vision for council. And we certainly, when we moved away and transitioned from Staten Island doing its own legislative breakfast, we definitely lost a certain dimension of that. And that annual meeting was very powerful. And when we combined with other boroughs, we weren't able to truly advocate. So Don and Barbara wanted to really have a separate rally and advocacy effort outside of that, where it could be specific on Staten Island, not just about legislators, but more about informed professionals, family members,
right,
discussing the topics that affect everyone day to day. And they've really created a wonderful agenda with the committee. Barbara and I had the opportunity. Barbara briefed me on a lot of everything, and it's I'm really looking forward to being there next week. I think it's going to be very informative to everybody. So we really encourage strong attendance. Hopefully we will have some legislation there just so they can see the need and the effort that was put into this. But this is going to be driven by agency providers, by family members, by the SIDDC as a whole. So please, if you can, make an effort to be there. It's next week at CSI. All the information's on all of our social media platforms, our website, and big thank you, Barbara, Donna, for spearheading these efforts.
My pleasure.
Marissa, can you put that flyer in the link so they can see it? Thank you.
Thank you. Okay, moving along, care management. I think Nick is on. I don't know if Janet is, but if you are, welcome. Good morning.
Hi, good morning. Yeah, it's just me today. How you doing? So we have a meeting coming up on Tuesday, and we're going to have a presentation about special needs trusts from Life's Work. And that's Tuesday, February 24th at 1 p.m. I'll put the flyer in the chat, but emails had gone out about that. So feel free to join. And I mentioned the last meeting a couple weeks ago that I started working myself. I have a new full-time job working for New York Home Care, New York Healthcare, which does home care. And we're looking to expand upon the OPWDD population, particularly children in the New York City region. So if other committees want me to, present, I can certainly do that as well. The idea is to have this in conjunction with the whatever IDD services they have, not to replace anything. And this is home care, home health aides, personal care aides, private duty nursing, and we also have an agreement with Wellbound. So to provide other therapies like speech services, OT, PT. So I will mention though that Staten Island is a tough place to staff. But we have a nice program at New York Healthcare to get people certified to become a personal care aide, home health aide. So those are things that can be discussed on an individual basis if anyone's interested. And that's what I have for now.
Okay, thank you, Nick. It's a great workshop ahead. Hopefully people could attend. It's always a
Yes.
relative topic that could give helpful information to families. So thank you. Okay, Family Resource and Transition Fair. I know we're approaching. You guys have been super busy doing a lot. So Irene, do you have anything to report on that?
Yeah, so the fair is April 17th at UFT on South Avenue. We're going to have a meeting right after this, a very quick touch base meeting. And, we've all been working on it, but I'm going to tell you, Marissa's been doing most of the work. To be quite frank, to be honest with you, she's got it all under control and has made it really, 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 really easy for us. And so if anybody wants to join the committee, please feel free to reach out to me, put it in the chat. I'll just include you. But we're looking at, April 17th, and we're excited. That's a very good venue. And they're very nice to us. So we're grateful to them. Okay. See you then.
Thank you, and thank you for that acknowledgement of Marissa. Marissa is wonderful. She's our admin assistant for council. If you don't recognize her, she's on the screen. And we also have Cynthia as well, who's our outreach coordinator, who's just joined us. So again, welcome, Cynthia, and thank you for joining us. You're doing a great job so far. But we can't do everything we do without both Marissa and Cynthia behind the scenes putting in the work. So thank you both for your efforts, and thank you for the acknowledgement. Community outreach, Michelle and Mary are both on.
Well, I'll be doing the minutes because Michelle's a little busy. Well, we did welcome Cynthia in last week at our meeting with her, and she's completed the trainings on Mobley and all the other systems that we use. We are going through regrouping our Mobley list to make sure that everybody's on it and everybody's getting the emails. So Cynthia and the group will be working on that. We did speak about our our goals for this year. We're really going to try to work on the young families. We are always pushing for our translation equipment and sharing that out there. We're also going to do self-advocates. We're looking forward to planning some kind of event so we can get everybody together. And let's see, younger families, I'm sorry. We're just trying to streamline the registration process. We're going to discuss that with the questions that should be asked so we can answer some of the questions at the beginning of the meeting, at the general council meeting. That's the purpose of the question. So hopefully we'll get that together. And our next meeting is today, right after this meeting. I think the link went up in the chat, so anybody that would like to join will be meeting right after this meeting is over. So thank you. Anything else? Did I forget?
Got it.
No?
Thank you, Mary.
Okay, thanks.
Thank you, Mary and Michelle. Appreciate everything you do. Education, I think I saw Maria on. Not sure if David's on. Maria?
Hi, good morning, everyone. I'm sorry I'm not able to get my camera working right now, but I am here. David sends his apologies. This is school vacation, so he's on a trip with his family, so I hope he's enjoying. We met on February 5th. We just had a small meeting with our membership, and David reviewed the survey that we had sent out. And we just sort of wanted to touch base with our membership and just hear from them as to what they were looking for. Also, we are going to link up with AHRC. There is a meeting coming up this week on February 26th at 7 p.m. that will be on Zoom, and it's nutrition and the picky eater. We feel that this does tie into education because so many of our students do come with additional, sensory or picky eating difficulties. So they've got a pediatrician and an occupational therapist, and I believe a speech therapist that are going to speak. So we just felt that that was relevant. And then we're going to plan our next meeting for mid-March, and that's going to be discussing some of the 853 non-public school options for families. And then David and I, of course, continue to meet, usually bi-weekly, the two of us, just to continue to come up with brainstorming and ideas to further our committee.
Excellent. Thank you, Maria, and appreciate how active your committee has been in trying to engage the community. So you guys are really doing a good job offering different seminars and information. So thank you again.
Thank you so much. We're trying, and we're always open to any suggestions, recommendations, and we welcome everybody to join in any of our meetings. So, we love to collaborate.
Appreciate it. Thank you.
Thank you.
Family Support Services. I know Marion is on. Not sure if Annette's on, but Marion?
Yep. Hi. We had our meeting on February 9th. We had about 15, 20 people join us, and we had a presentation from Unlimited Athletics Group, which provides adaptive sports training and coaching to many of our families right now. And our next meeting will be March 9th, and we're still working on getting a speaker together for that. But Annette and our new co-chair, who will replace me at the end of the year, Denise Purcell, are working on figuring out who's going to be our next speaker and for the next few months. So. And just wanted to say that I posted in the chat the brand new, just picked it up today from yesterday from the printer, the new family support brochures. Finally published.
Okay, thank you, Marianne. Appreciate everything you guys are doing as well. Moving along, we have Health and Clinical. I see Maggie's on. Maggie?
Hi, good morning. I believe Jane may be on. I'm
Yes,
not
I'm
sure.
on. Yes.
Oh, I
Hi.
apologize, Jane.
It's
Didn't see you
okay.
there. Hi, Jane. Hi,
Hi,
Maggie.
everybody.
So we did have a special guest presentation with Dr. Nona on February 4th. She gave a presentation on medication reconciliation with patients with IDD. It was an excellent presentation. She gave a lot of resources and answered a lot of questions for parents and guardians on I guess it was guiding parents and guardians on questions and what to ask and what to expect when you bring your loved one into the hospital or bring them in for a doctor's appointment. Just some key questions to ask and expect when you do come in for any kind of healthcare services. There were a lot of great questions that parents had, and Dr. Nona answered all the concerns and added a lot more information that I don't think any of us really thought about when someone comes in and they're here for a long stay at the hospital. So it was really just a great presentation. I wish there were more people who attended, but the ones that did, they really got a lot of information.
I think we had somewhere between 10 and 12.
Yeah.
including myself, yeah.
Yeah.
Yeah, it was.
Our next meeting is March 19th on a Thursday. And then we'll prepare for another presentation in May that we're looking forward to. So we're going to just, get more information on the presenter, the presentation, right, Jane?
Yes, I'm reaching out to her, yes.
Yes. And then we'll send flyers around to advertise for that and hope that we'll get more people to attend that presentation because that's going to be another exciting one.
I just wanted to ask Marissa, we had hoped that Dr. Nona presentation was recorded. Do you know if it was and if it's up?
No,
checked the following day and I didn't find it.
Yeah, no, that
No, I
wasn't.
went into Zoom to check if it was recorded, and the meeting itself was not recorded.
Oh.
Right.
If meetings are recorded, they soar straight to Zoom.
Too bad, because she gave
So I looked for that. This way I could show Cynthia to send it over to Cynthia to post it, but it wasn't recorded, the meeting.
I'm sorry.
We thought we
no,
did.
Maggie, I guess our electronic tech skills need
I
honing.
know. We thought we did hit record and we were happy and proud about the fact that we remembered, but I don't know what happened. So we'll try
it was
again
really good
next
because she
time.
covered like multiple issues related to, healthcare treatment, especially in the hospital, and all the she hit all the relevant points, from admission through discharge, skin
Right.
integrity, communications. She was really very good.
Yeah, and then right after the meeting with the presentation with us, Dr. Nona went directly to residents here at the hospital and gave a presentation to residents to educate the residents on how to work with individuals with disabilities. So that was really great that she was able to hit it on both sides.
Maggie,
So,
would you
yes.
would you be willing to share her contact information? I'm on this new District 75 citywide council, and they were specifically asking if she could speak at one of their meetings when they heard
Sure.
about it. Yeah, so if we
Sure. Yeah, just give me a little bit of time because I'm not in the office right now, but I will send that.
Thank you.
She gives so much information in such a short period of time that you have a hard time keeping up with her because she has so much experience and knowledge in the area. She's over 30 years working with this population. So it was really very enriching to hear her. So.
Thank you,
Smart.
Jane and Maggie.
Yeah.
Appreciate everything you're doing. Okay, membership and guidelines, Gail, Pam. Okay, so Gail was on earlier. She may have to excuse herself. All right, we could move on.
Gail's there. She has to unmute.
Oh, okay.
Sorry,
Gail?
I was
That's
talking.
okay.
I'm sorry, Jason.
No, don't apologize.
Okay, Pam is not able to be here today. So the Membership and Guidelines Committee made a few minor adjustments to the membership and guidelines. The first one was that the executive board meetings that the co-chairs and the executive committee have should meet at least 2 of those in person. That passed. The second one was that at least 4 general council meetings between September and June should be in person as well. That also passed. And the last amendment that we made was for the secretary to submit the minutes to executive board meetings within 10 working days. So all of those changes passed, and the updates were done, given to Marissa, and so that hopefully that was, I believe they was distributed to at least the executive committee. We're always looking for anybody who would like to join our committee. We help out with outreach, community outreach as their membership and guidelines arm. And I was happy when I registered today for this meeting that a question popped up and it asked if it wasn't my first meeting. And so I was really happy with that question. I would love to see maybe if you're a new member, just because it's your first meeting doesn't mean you're a member, or if you'd like to join a committee, maybe we could add those in the future. But I had made a note about recording the meetings because when they were talking about Dr. Nona and how great her, thing was, presentation was, that, committees that have really great speakers, or even, any speaker, should try to record the meetings so that others who can't attend be there. Maybe we can do a little instruction on how to do the recordings, because it is tricky. Even still, after all these years, Zoom changes. So, but that's it for membership and guidelines. Thank you.
Thank you, Gail. I just had a quick question. Are those changes in guidelines going to affect immediately? So I should schedule 2 executive board meetings for the remainder of this calendar year, or because the calendar was already sent out for in person?
I think they take effect immediately, but it doesn't specify, so I don't think that we will hold ourselves to that for this year, since it's very short time left. Thanks, Jane.
I appreciate that. Thank you.
No worries.
Okay, moving along, we have residential quality of life. I believe Danielle is on the call.
Hi, good morning. Can you hear me?
Yes, we can.
Okay. Hi, good morning. So we are charging along. We had a meeting in January where we had a presentation. Unfortunately, didn't have a lot of people. We had a low count of people. So, but we did have some people. We did have a presentation on Pro that was ready to go. But we will present again. I'm looking to have another meeting in April. We'll skip for March, but we'll have another meeting in April. I don't have a date set yet. I'll put that out today. I'll send out a flyer. I'll give it to Marissa for April. And hopefully we'll get a better turnout. We did send it out though for January. And, as I said, unfortunately, we didn't have a great turnout. We also had a meeting in November. Again, the turnout wasn't great. So I am hoping that, we can get more people to come back to residential quality of life. Unfortunately, as everybody's aware, Iris has not been able to be with us, and I'm, hopeful that she will come back. I'm sorry about her circumstances. So I have been, trying to hold the meetings by myself and looking to get a better turnout. And I apologize for not being available to some of these meetings. I'm doing the best that I can. But I am looking to start over, fresh start, and hopefully the turnouts will be better going forward. That's all I have.
Thank you, Danielle. Appreciate your efforts moving forward. And again, residential quality of life. If anyone's interested, whether you're a service provider, whether you're a family member with a loved one in a residential setting, or if you're considering residential for the future, we certainly encourage you to attend those meetings. They're very informed. Historically, we've had professionals from multiple agencies represent to give information on what to expect, and also just to have a healthy dialogue about residential living, which is a lot for any of the providers that are here or anyone that has a loved one in a group home. There's just a lot that is consumed within a residential placement. That is one of the largest services an agency can offer. So Danielle's really looking to facilitate an active committee, and she has great ideas for presentations, and we'll have the residential quality of life definitely spearhead our June meeting, which is our DSP award recognition, which is one of the highlights for council. So again, thank you, Danielle, and hopefully we'll work closely with Marissa to get an active committee for residential.
Thank you, Jason. I also had a few families reach out to me via email. So I did send those, I did give them a heads up about some of the meetings. So hopefully they will join the next meeting in April. I have kept in touch with them. So we'll see what happens.
Excellent. Thank you. Okay. Self-directed support. So I know Melissa's on, but is having some technical difficulties. So Fadaya will be giving the report in her absence. Thank you, Fadaya. Fadaya, you just have to unmute. Come on, we're 5 years into this now, Fadaya. Let's go.
I think it's almost, what is 6 actually? It'll be 6 next month. Yeah, so I said, I live and breathe self-direction, so I'm happy to talk about it. But Melissa and Marissa had a great meeting this week on the 18th. I was there. They had someone from a Billy B app, which is like a transition, if you're transitioning to high school, for parents to track all that stuff, which was really great. And then Shivu presented, which is a recruiting app, which sounded really great, where you can actually search for DSPs, ComHab, Respite. It's $20 a month, can actually be paid through your budget. So it was really great. And the next meeting will be sometime in March. She'll let us know when, where exactly. Thank you, everyone.
Thank you, Fadaya. And you were right, we are 6 years into it. We're approaching the anniversary. We'll always remember that day of infamy when we got the email that all programs are shut down.
Crazy.
OPWDD sent it. I think it was like probably March 5th. I remember the beginning of March where we were mandated to shut down all services, of course, except for residential. Okay, last but certainly not least, we have Willowbrook Legacy. I believe Janine is on the call. Janine, do you have an update for us?
Yes, I'm here. Good morning, everyone. I apologize for not having my camera on. We have been meeting monthly with the College of Staten Island to organize events to bring awareness to the Mile and the Willowbrook Legacy. We're excited to announce that we will have an event on April 28th, which will be at the CSI Library, which will bring awareness to the CSI archives in terms of the legacy of Willowbrook. And that event will be on April 28th from 2:30 to 4 p.m. So we will be sharing, we're hoping that the college gets that save the date approved, and we will be sharing that shortly with the rest of the committee. We also have scheduled on the calendar a Willowbrook Mile walk and lecture, and that will be in September, on September 18th from 12 to 3. So we will have a lecture and then we will walk the mile. We're hoping that we get a lot of people to join. We want to build a lot of awareness of this and get all the agencies to represent and bring awareness to the mile. So we're very excited and we're hoping that the future is bright with the Willowbrook Legacy.
Thank you, Janine. That is wonderful. Hopefully this time around the weather is better. Last time
Yes.
it was
pouring
like
last
a
time.
horrible rainstorm. But
Yeah.
we still had a few attendees.
Yes.
And I really do encourage strong attendance. I mean, it's so great that we have a committee that everyone is reminded of the history. Staten Island is infamous and historic for, what happened here firsthand. And that's what really Willowbrook closing is really what led to all of the development and inception of all these wonderful services for your loved ones. So it's
Yes, if anyone wants to join, please, I'll share my email and Eli's email. You could reach out to either one of us if you'd like to join the committee. We'd be more than happy to welcome you. So I will share that.
Thank you,
Janine, this is Jackie. I haven't
Yes.
received any notices about any meetings.
Oh, our next upcoming meeting is March 2nd.
Okay.
And our next meeting with the college is March 10th. So we've been meeting a smaller group of us with the CSI because, as you know, half of the mile is on CSI grounds and half of the mile is on Willowbrook grounds. So
That's right. Yeah.
yeah, so we kind of were able to straighten out a few roles and, work collaboratively together. So our next meeting is March 2nd. I sent out an email. You should have gotten it.
I haven't received anything, but is that for the
Okay,
full committee?
I'll check.
Or
Yes,
just the
the full
CSI?
committee. Yeah.
Okay. Thanks.
Yeah, and I believe we're going to start welcoming the full committee to the rest of the meetings with CSI as well.
Oh, okay, great.
Yeah.
Thank you.
Thank you,
course.
Janine. Appreciate all of
Thank
it.
you, everyone. Thank you.
Thank you. Okay. I went on mute. That concludes all the committee reports. So thank you really all of the co-chairs and taking your time to put together. Council is on a voluntary basis, everyone. So everyone takes their valuable time, whether it's personally, professionally, to just get all of this information and work towards just working together for the greater good here. So thank you everybody for everything you do. I just would like to leave the last minute or two if anyone has any new business or old business that they'd like to share. You could kindly unmute, raise your hand if you have anything you'd like to report or share, new business, old business.
No, Jason?
Yes.
I don't know, my virtual hand was not going up. I just wanted to let everyone know that CP Unlimited will be having an open house on March 18th from 10 to 12. I put the flyer in the chat.
Thank you, Melissa. Great. Does anybody have any other new business or old business?
I have a question.
Yes, please.
Jason, I have a question. So for the rally next Friday at the college, it's in 1P, that's where the auditorium is, correct?
It is, and it's a town hall, Jane. We're not rallying.
Sorry, yes.
Informational. But it's in 1P.
So I just have a question because I have trouble walking uphill for several medical reasons. I can walk down the hill, but not up the hill. Are they doing anything because the parking is just so
Bad.
horrible? So I know sometimes they have golf carts available to take people from the parking lot to the building. Is that?
I'm not aware of that, but we can ask.
Yeah.
Maybe someone can drop you off,
I can't,
Jane.
yeah. I just can't walk uphill in the cold weather.
No, I'm saying maybe someone can drop you off.
Okay.
You know,
That's
there.
circular
You
driveway.
I could meet somebody.
Yeah.
Bring my car there, meet somebody there, and they can. I can get back to my car, but as I said, it's all uphill when you have to go from the parking lot, and I just, medically, I can't do that.
Jane, if you want to connect, I'm happy to meet you in the parking lot and drop you off.
Oh, okay, Jason, that's the deal. I'll get in touch with you, okay?
Absolutely. And
I
that's
would like to
applies
be
to
there.
anybody
And
else. Just
sometimes
let me
that
know.
stops me from going to things at the college.
Yes, that parking is very bad for that theater. So
Terrible. It's not, and it's a school that promotes its commitment to disability, but I'm not going to say another word.
it's rough. And then they have buses. Maybe they might
Not all disabilities are visible, so.
they might let you park on the corner there because it's not a school trip. There are no buses. So that's something you can ask too.
And also, it's a Friday, so Friday is a much lighter day parking there, and that's the reason we got it. But
because even their handicap parking is really not accessible to that building.
It is.
But the college is really working. They're not charging us for the space.
Oh, no,
And
I know.
they're going out of their way to accommodate us for that day. So
Okay.
we are appreciative of
Jason,
what
I
they
may
do.
just get in touch with you then and just link up. As I said, I could walk back to my car, but if it's cold and windy or anything, even if it's not, walking uphill is hard for me, but when it's cold and windy, I'd probably have to stop about 12 to more times. Yeah.
Jason,
totally understand. It's not easy.
Downhill, I could walk flat, but uphill.
No, we're all either gonna get there one day or we're there
Oh,
now, so
yeah, I'm
we
really
get it,
there.
Jane. No worries. But anything we could do to help.
I
Absolutely.
told somebody I used to teach gerontology. I taught it in many different locales, many different settings, colleges, graduate school, physician's assistants, community lectures, and now I live it. So,
Mhm. All right, thank you. Anybody else
Thank
have
you.
any old business or new business? Okay, so it is 11:03. Thank you, everybody, for your time today and for attending the meeting. Hope you were able to get something out of this. We hope everyone enjoys the rest of your weekend. Hopefully, no snow. And just thank you again. Hope everyone has a great weekend, and we'll see you next Friday at the town hall. Thank you, everyone.
Bye, everyone.